Okay, guys and girls, part 2 of our physician careers PowerPoint. So, we're talking about therapeutic careers now, and this says page 101, and that's because that's in our textbook, which you don't have access to. So, I do want you to look at some of these careers, look them up, Google them. Yes, you can Google this time. I do want you to know what some of them do. So, if you think occupational therapy, I want you to think typically upper body, arms, like teaching a patient that's had a stroke how to put their clothes on because one arm is paralyzed. The occupational therapist is more with getting them physically able to do something even if they're sitting in a wheelchair, like brushing their teeth with one arm, giving themselves a bath with one arm if they've had a stroke or an amputation. Life is a lot different for patients that are at a disadvantage or are disabled because of a stroke or an amputation or some type of traumatic brain injury. So an occupational therapist is going to teach them how to do their everyday things, their activities of daily living, getting a bath, washing their hair, cooking themselves lunch, brushing their teeth, things like that. So any of these careers, if you think therapist versus therapy assistant, the therapist, of course, is going to have the higher of the education levels, no matter what it is, occupational therapy, physical therapy, recreational therapy, whatever. So the therapist is going to have more of an education than the assistant. Makes sense. The assistant is going to do just that, assist the therapist. So when you're talking pay rate, who's going to make the most money, the therapist or the therapy assistant? And of course, that is always going to be the therapist because they've got higher levels of education. So the pharmacist, you know what the pharmacist does. He or she is going to dispense medications based on the prescription that was given to you from your doctor. Okay, the pharmacist does not write prescriptions. He just dispenses the medications. And I always say he, but you know, guys, any career can be any sex, male or female. That pharmacy technician, again, is going to assist that pharmacist. They're going to fill prescriptions under the supervision of that pharmacist. Physical therapist, same thing. Physical therapy assistant. Massage therapist. Now, the massage therapist usually doesn't have an assistant, but that massage therapist is someone that actually uses tactile stimulation. They massage the body to help with illnesses and ailments or whatever. Or sometimes it's just because it feels good. So, give your mom a massage coupon for Christmas to a massage therapist. She would love it. A recreational therapist. It's just what it says, recreation. It's fun. So patients that are in facilities, maybe they've had certain traumatic accidents, strokes, car accidents, brain injuries, whatever. Sometimes we do recreational therapy to help that person. Sometimes that therapist may take them to the mall and may take them out shopping to expose them to different parts and different activities in the community. That's what that recreational therapist is going to do. Respiratory therapist, respiratory, of course, is breathing. They're going to give breathing treatments and help with things like that. Speech therapist or pathologist is going to help you with your speech. Pathologist is going to help you. The speech pathologist, it's all dealing with your speech, and of course, it does go along with hearing, because if you can't hear very well, you're going to have trouble with speech. And lots of people can need speech therapy. It could be someone after a stroke that's having difficulty swallowing. That speech therapist can help with the swallowing activities. An athletic trainer, you know what an athletic trainer is, guys. They're going to help train your athletes. A perfusionist, this is actually a pretty cool, I think it's a master's degree program now. And that perfusionist is a person that works in the operating room, and their sole responsibility is managing the heart-lung bypass machine that a patient is on if they're having heart surgery. Now, excuse me, that heart-lung bypass machine is just what it says. It is a machine that pulls the blood out of your body, and it bypasses the heart, which is just a pump, and the lungs, which allow for the exchange of gases, oxygen and carbon dioxide. So your body can't do that while you're having heart surgery. So this machine takes over that job and it does it for you. But there is someone that is specifically trained and in that operating room to work or be responsible completely for the workings of that machine. And that's what that perfusionist is. Okay, now let's talk about body mechanics. We're going to do another skill, body mechanics. Body mechanics is just making sure that you are doing things correctly to protect your body. Okay, so when you're lifting something heavy, when you're lifting a patient up in the bed, like sliding them up in the bed, if a patient's falling in the floor and you've got to pick them up, or if you've just got this huge piece of equipment that's in the floor and you need to pick it up. So you always need to have a broad base of support. Your feet should be shoulder width apart when you're trying to lift something. If you're picking up heavy objects, make sure that you get close to the object, that you bend at your knees and your hips. Don't bend your back. Okay? Try to keep your back as straight as you possibly can because you want to protect that spine. Now, if you're carrying heavy objects, you want to carry them close to your body. Don't try to hold them out, and that's going to kill your arms and hurt your back trying to hold it out away from you. So hold it close to your body, and that's what most of us do. Again, always keep your back straight. Don't try to twist. If you're standing there and you need to move something to your left, don't twist and sit it down to your left. Turn, move your feet, and put it down, okay? Don't twist. That's where we come into having back trouble, when we're twisting and causing pinching in those muscles and nerves that are coming off of our spine. If you can, you need to push, pull, or slide a heavy object. Okay? Don't lift it up if you don't have to. If you can slide that huge box across the floor, then slide it because you're protecting yourself, and that's what you want to do. You've got to have your back for the rest of your life. You want it to be healthy. Okay? Now, if you are having to lift something heavy or move a patient or do something, if you tighten your stomach muscles, that's going to give your core more support. And that's what you need to do. Tighten up those stomach muscles so you can have more support for your core and have more strength. Okay? Now, going on to veterinarian careers. You know what a veterinarian does. Doctor of Veterinary Medicine, DVM. Now, remember we said DP, like Paul. DPM was Doctor of Podiatric Medicine or Podiatry, and they deal with your feet. So don't get them confused. Veterinarian is DVM, Doctor of Veterinary Medicine. That's the doctor for your pets. They're the ones that's going to actually do surgeries, prescribe medications, do assessments, things like that. Okay. The veterinary technician works under the supervision of that veterinarian. They can collect specimens, they can assist with surgeries, they can administer prescribed treatments by the doctor. Now, of course, they're going to make less than that veterinarian because of education requirements, okay? That veterinary assistant also works under the supervision of that veterinarian, and that assistant is usually one that feeds the animals, grooms them. They can assist with exams, they can exercise the animals, and they can prepare the animals for treatment that the technician or the veterinarian might do. Vision services. When we talk about an ophthalmologist, that is a medical doctor, just like that cardiologist or radiologist or family doctor. They're the exact same, but they specialize in treatments or diseases of the eye. Okay? That's their focus, is just the eye. Like a cardiologist just focuses on diseases and disorders of the heart. This ophthalmologist is a medical doctor who just treats diseases and disorders of the eye. They can also perform surgery just like that cardiologist can, okay? So an optometrist examines your eyes. Can't do surgery on your eyes, but they can examine your eyes. They can actually prescribe glasses or contacts for you. They do have to go to a school called College of Optometry. Okay, so they're the ones that usually examine your eyes and prescribes glasses or contacts, but they do not do any kind of surgeries or treatments on your eyes. Now, we have an ophthalmic technician. They usually have an associate's degree, and they actually help the ophthalmologist, or optometrist. They get patients ready for exams. They can take ocular, which is eye measurements. They can do vision screens. And ocular measurements, I don't know if you've ever had this done, but when you go to the eye doctor, sometimes you'll have to look in this machine and they give you like a little puff of air that kind of goes into your eye. That's measuring the pressure inside of your eyeball itself to check for glaucoma, because glaucoma is an increased pressure in that eye. Okay, and that ophthalmic technician is going to do a lot of those tests before you see that optometrist or ophthalmologist. Now, an optician, you need to know this. The optician, the only thing he or she does is make your glasses. That's all they do. They make the glasses based on the prescription from your ophthalmologist or optometrist. Okay? They make sure the glasses fit properly on your face, but you need to know the optician, the only thing they do is make them fit glasses. Now, we're going to talk about vision screens. So, when you're getting ready to do a vision screen on a patient, you've had it done yourself at the school nurse or wherever. So, you're going to make sure that your patient is eye level and 20 feet away from the eye chart if that's the eye chart that you're using. Of course, wash your hands. You're going to wash your hands, everything. Greet your patient, identify yourself, let them know what you're doing. Now, have your patient take their glasses off. They're going to cover one eye with an occluder. Oh, that's supposed to be occluder. That occluder is not the patient's hand, because you don't want their hand, the dirty hand, up around their eye. So that occluder covers your patient's eyes during an eye test, and the official occluder kind of looks like a spoon, like a kitchen spoon. It's like a big spoon. It doesn't touch your eye, but you hold it up in front of your eye, and it blocks or occludes you from seeing out of that eye. So you're going to have the patient read that eye chart. If you cover your left eye, then you're going to have them read the eye chart with their right eye. You're going to swap around. You're going to do the same thing. Cover their right eye, read it with their left eye. Then you're going to read it with both eyes to make sure that both eyes are working properly and working together. Then, of course, you're going to document it. Okay? If you don't have an occluder, and I think this is a test question, the best thing that you can use for an occluder is an index card. It's clean. It's not got any, germs from doorknobs and everything like that on it, like our hands would have. And that's about it for occluders. And that's it for this PowerPoint, guys.